My name is Natalie Nguyen. I'm a third-term student at West Coast University. I'm in the BSN program. Well, my goal with the program is to get my bachelor's and hopefully get into medical school. Besides school and work, of course, I volunteer at Cedars-Sinai Medical Center. It's in Beverly Hills. Like nursing school, it's very rewarding. I learned a lot of new things. One of my favorite things there is like pretty much my job as a volunteer. When I first get onto the floor at 7 a.m., I round on patients. I'm on the oncology floor, so I have long-term patients there. I will go once or twice a week, to make sure that they're cared for the way that the staff can't really care for them. As a volunteer, you're on a personal level. You're the patient's advocate. So whatever the patient needs, or if they need someone to confide in, they look for you. So when I go on the floor, I get the patients ready to eat their breakfast, and then after I will go help the nurses at the nurses station. It's really nice because that's where you learn everything. The nurses will tell you everything you need to know about patients. They'll tell you which patients you should visit, which ones you shouldn't. You help them answer pages from their patients. And then you also get a lot of calls from other departments and doctors, which is really nice. You kind of get a feel on how it is to be a nurse. And then after about an hour and a half, when the patients are done eating their breakfast, I go around on them again just to make sure that everything's okay. I take away their trays, and I pretty much, sit there and make sure they're doing okay. Their family members, most importantly, well, besides the patient, their family members are very important to them. So we want to make sure that the family members are comfortable as well. So besides learning how to be a nurse, I learned how to communicate with patients, which is really nice. I learned that I have to be compassionate. Because I am a volunteer, I get to connect with the patients the way nurses can't. It's more on a personal level. We're friends, that's my second favorite thing being a volunteer. I get to make a lot of new friends, whether it be other volunteers, nurses, doctors, future doctors like new residents, anything like that. It's very fun. The best thing about the whole making new friends and building relationships is that later on, if I ever do need anything, so the people I know or gotten to know, they'll help me out, which is really nice. If I ever needed any letters of recommendation, anything like that, I don't have to worry. That's the good thing about volunteering. You build these relationships. After learning all the new things and making new friends, besides those two, volunteering is rewarding in a way where it's good for you. I get health benefits for volunteering at Cedars-Sinai, which is very helpful considering I'm a college student and I can't get health insurance any other way. Once in a while we get volunteer appreciation days. The staff really appreciates us for helping them. Besides just walking around the hospital and saying hi to patients, you really do help out the staff. So after all, I would really recommend you guys do volunteer work, not for the experience, just the experience, for all of the benefits, for the new relationships you'll build, and just for your future. You gotta get out there and gain this knowledge. It's really good for you. Alright, and I'll see you guys later. Thanks.